Good evening. I'm Andrew Chang.
I'm Adrienne Arsenault. Tonight, a surge in coronavirus cases in Canada and more deaths.
As tens of millions of Canadians move into a state of emergency.
Don't go out unless you absolutely have to.
Empty streets, stores closed.
COVID-19 constitutes a danger of major proportions.
The urgent appeal to stay home and stop the spread.
With so many worried about paying the bills, help is coming. What CBC News has learned about a $25 billion aid plan.
And Canadians anxious about stranded loved ones desperate to come home.
I'm feeling scared, I'm feeling worried.
And are you really washing your hands properly? We can see right on the handle there. Plus, how to talk to your kids about the pandemic.
Coronavirus is taking over the world.
What you need to know. This is The National. There has been a jump tonight in the number of coronavirus cases in Canada, as well as in the number of deaths connected to the pandemic.
3 more in British Columbia and 1 in Ontario, bringing the total fatalities in this country to 8. At the same time, 3 more provinces took some extraordinary steps today to try to contain the spread. So Ontario declared a state of emergency this morning. Hours later, Alberta, then British Columbia, declared public health emergencies. In BC, the announcement came with news of a spike in cases and deaths. Tina Lovegreen begins there.
Again tonight, this is the site of more COVID-19 deaths. 2 more residents at the Lynn Valley Care Centre, where already 4 have died.
And we, as long as everyone else, grieve with those families. And this is truly another somber day.
Another man in his 80s from BC's Fraser Health region also died in hospital. With the new deaths, dozens of new infections.
83 new cases added to our database today.
The total in BC is now at 186. Across Canada, cases now hover at around 600, with many provinces adding new ones.
The number of cases in Ontario has risen rapidly, and over the weekend, we noticed that the cases moved from almost doubled from 70 to 80 up to 170.
In Ontario, the first death of a patient with COVID-19. The 77-year-old man was a close contact of another positive case.
The deceased was in his 70s, had other pre-existing medical conditions that would put him at risk, and so the relationship between his infection and his death is under investigation.
In New Brunswick, a boy under the age of 10 has tested positive, and PEI's sole case has sparked a warning. Anyone who took WestJet flight 3440 from Toronto to Moncton on March 7th is now asked to self-isolate. Hospitals around the country are preparing for what's to come, clearing beds, canceling elective surgeries.
I can tell you that we're ready to look after patients in our hospitals who will have COVID-19.
And health officials are appealing to everyone to do their part.
The best way for us to come together right now is to stay apart.
A message echoed across this country. Tina Lovegreen, CBC News, Vancouver.
Now, Dr. Isaac Bogosh is an infectious disease specialist, and you're joining us from outside the studio. We're doing a little bit of social distancing. Now, it's easy to get caught up in the fervor and the anxiety of each new development. So you tell me, how do you see where we're at right now?
Yeah, well, if we take a step back and look at the 30,000-foot view here, we can see that we're getting more and more cases day by day in Canada, and a greater proportion of those cases are locally acquired cases, meaning someone hasn't traveled anywhere, there's no obvious contact. These are locally acquired or community acquired cases that are contributing to our case burden here.
And so with all the measures that we've seen, be it travel restrictions, all the social distancing that we're doing, how long until we know whether it's worked?
It really takes about 7 to 14 days after a policy is enacted for us to see the outcome of it. So the cases that we're seeing now are really reflective of policies that were enacted 7 to 14 days ago. And with the travel restrictions and all the social isolation measures that we're taking, we won't see the outcome of that for about 7 to 14 days from now.
Okay, Dr. Bogosh, thanks very much.
My pleasure.
And so 5 provinces are under states of emergency tonight. Ontario, Alberta, and BC today joined PEI and Quebec, ordering nearly 24 million more Canadians to limit public contact. This was rush hour tonight in the country's biggest city, a staggering image of life under restraint during a pandemic. Ellen Morrow shows us how far the provinces are going and the hardship that could follow.
From 3 of Canada's largest provinces today, the same stark message.
COVID-19 constitutes a danger of major proportions.
Decisive action is needed, and we are taking that action.
This declaration of an emergency enables me to be faster, more streamlined and nimble.
That means gatherings of more than 50 people are canceled. Recreational facilities like gyms and arenas are closed, as are entertainment venues like casinos and bars. Childcare centers, too, are shuttered. Mom Charlotte Dobo is worried about her son, Isaiah. He has autism and struggles without routine.
This is a 24-hour-a-day, 7-day-a-week job, which has just become 100 times harder.
While most restaurants in Alberta and BC can stay open, Toronto chef Alita Solomon is closing indefinitely.
It's obviously the right decision to close. It's just sort of now, what do we do now?
5 provinces now, including Quebec and PEI, have introduced emergency measures, but are they enough?
For everything that they do.
This frontline doctor is calling for a nationwide shutdown.
I'm the one putting the breathing tube in the patients who are going to have this disease. This will beat us if we don't act to get ahead of it.
Still open malls, pharmacies, and grocery stores, including Toronto's St. Lawrence Market, though some are concerned about coming to work.
And I said to my guys, it's totally up to them if they're going to show up for work. It's understandable. They have families to worry, so whoever is feeling uncomfortable.
Worry and fear, emotion stalking Santiago Diaz.
We need to pay a lot of things, and the people is not around here.
People staying away for now in hopes the virus fades too. Ellen Morrow, CBC News, Toronto.
Now, the Prime Minister today didn't rule out invoking the Federal Emergencies Act. He says the government's taking a closer look. But for now, as David Cochrane tells us, his message to Canadians is twofold. Financial help is coming, and we need you to stay home.
Like millions of Canadians, the Prime Minister is working from home at a time when doing just that has never been more important.
Our doctors and nurses need your help. Your neighbors need your help. Vulnerable people in the community need your help. As much as possible, stay home. Don't go out unless you absolutely have to.
Urging Canadians to stay home, urging those abroad to come home, but admitting for some it won't be possible. Not, he says, with 3 million Canadians out of the country at any minute and flights being canceled by the hour.
And I think it is just realistic to know that there are some of them who will not be coming home in the coming weeks.
The broader message was for everyone to follow the public health advice on hand washing and social distancing, and to brace for the long-term disruption that is necessary to slow the virus.
We don't know exactly how long this is going to take, whether it takes weeks or months, but we know that every step of the way, we will be there to support each other.
Supporting each other will take a lot of government money, so the House of Commons will be recalled to amend legislation to make employment insurance available to more people. Just one part of an aid package coming on Wednesday to take the financial stress out of social distancing as much as possible.
We all agree we need to do whatever it takes. We have to put in place the measures to help us get through that period.
Those measures will help people pay rent and buy groceries and support businesses to better times. Sources say the value of the package will be at least $25 billion. David Cochrane, CBC News, Ottawa.
So let's meet some of the people desperate for that kind of financial help. Many don't have the benefits or steady jobs and would otherwise slip through the cracks. Aaron Saltzman shows us what they're up against.
Behind the eerie scenes of empty streets and shuttered businesses are people who suddenly have to figure out how they'll pay the bills.
Depending on how long it goes, I might be in a pretty tight spot.
The scope of the problem is immense. Hundreds of thousands of people on low incomes who can't work from home, with no sick leave or benefits, who can't even collect employment insurance.
As it's set up right now, the vast majority of people don't qualify for EI because they don't have enough hours.
The government has already extended some EI benefits for those who otherwise wouldn't qualify, if they're in isolation. But even people who will get employment insurance, like this cook who was just laid off, will see their income cut almost in half.
It definitely will affect my life, not having the same amount of money coming in won't be as easy to deal with.
So more help is coming, as other countries show what can be done.
De 300 milliards d'euros.
France is giving businesses access to hundreds of millions of euros to make sure they don't go bankrupt. It's also suspending rent payments, taxes, even household bills. In Canada, economists say the government should start with income replacement, especially for those who need it the most.
The most effective way to ensure that those people can keep consuming and keep about the economic activity that they would normally have in place is to put cash in their hands.
It is sorely needed.
There has been a big decline in business because everything is shut down now.
I have been paying my taxes. I have been contributing in social programs. Why can't the government help me out?
It's coming, the government says. More details tomorrow. One look outside shows it can't come soon enough. Aaron Saltzman, CBC News, Toronto.
Well, now to another group of Canadians facing a lot of uncertainty tonight. They're outside of the country, and they desperately want to find a way home. Thomas Douglas spoke with some of them and looked into how the Canadian government is trying to help.
Let's hope they answer.
Mary Hill is trying yet again to reach her parents, stuck on a cruise ship with limited Wi-Fi and desperate for answers.
It's not going through.
Bill and June Hill had been enjoying themselves on the Norwegian Spirit. That's until the ship was denied port repeatedly. Now it's sailing off the coast of South Africa with passengers unsure how or when they'll get home.
I'm feeling scared. I'm feeling worried. I don't know what to feel, and I just wish we could get some answers.
More than 414,000 Canadians are registered abroad, and many who want to come home still can't. From the Middle East,
my permanent residency is going to be expired. What they gonna do?
To Europe,
I don't know if I'll be able to get home right now.
And South America.
We've been scrambling all day yesterday to try to get out, but to no avail.
Travelers in Peru are the latest to feel stranded after the country shut its borders, deploying security forces to the streets.
A few days after we got here,
Carrie Roach had to pay an unplanned 15 days accommodation up front just to stay put.
It's not just the 2-week quarantine here, it's getting home and doing another 2-week quarantine and not being able to go back to work.
The Canadian government isn't committing to getting everyone home. In fact, they've already banned anyone with symptoms from getting on a plane.
We're working with airlines to try and make sure that as many Canadians as possible, as many Canadians as want to, can come home.
The government is offering emergency loans and pledging more help to come. Mary Hill got a call back from her MP's office. She pleaded for more information, to no avail. So like everyone else, she waits.
All right, well, thank you for calling back.
Thomas Douglas, CBC News.
Okay, bye-bye.
Toronto.
In the United States tonight, COVID-19 has now spread to all 50 states, and the number of deaths has surpassed 100. As Katie Simpson shows us, as those figures and fears of unemployment grow, so does the government's emergency economic plan.
Calls to stay home are being taken seriously in Washington. The mayor ordered widespread closures here, leaving the city at a near standstill. In Florida, one of 3 states holding a primary, turnout was not enthusiastic, with voters taking precautions. And in San Francisco, home to 7 million people, a lockdown has all but ground the local economy to a halt.
We're looking at sending checks to Americans immediately. Americans need cash now, and the president wants to get cash now. And I mean now, in the next 2 weeks.
The White House is pitching a new $850 billion stimulus package, which includes those direct payments of roughly $1,000 per person. It's also backing relief measures for airlines.
This is worse than 9/11. For the airline industry, this is they are almost ground to a halt.
The president appeared to share that sense of urgency, promising the economy will rebound once the outbreak is over.
It's going to pop. One day we'll be standing possibly up here, we'll say, well, we won.
Donald Trump even put aside partisan politics, vowing to work with New York's Democratic governor after a desperate plea to help increase hospital bed capacity.
You now have this influx, you can't handle it. You overwhelm the hospitals. You have people on gurneys in hallways. That is what is going to happen now if we do nothing.
The Trump administration is considering the use of military field hospitals if necessary, while also asking for donations from the construction industry to help fill other gaps.
Those industrial masks that they use on construction sites are perfectly acceptable for healthcare workers.
As more tests are done in the U.S., the scope of the outbreak will expand. Expect further social distancing restrictions and additional requests for medical help. Katie Simpson, CBC News, Washington.
Now, around the world, a number of countries have gone into varying degrees of lockdown. And today, a number of countries made a joint move to keep people out.
Let me stress once more, we are ready to do everything that is required.
The European Union is closing all external borders to most non-essential travel. That's for 30 days. There are some exceptions being made for medical staff and medicine, for example, and people can still, for the most part, travel within the EU. And in Australia, Prime Minister Scott Morrison has upgraded the official travel advice to an unprecedented level 4 in the country, urging Australians to abandon all overseas travel because of this pandemic. Non-essential indoor gatherings were also limited to 100 people in the country. And Morrison urged hoarders to stop panic buying, saying it has been one of the most disappointing things he has seen in response to the crisis.
Acting quickly and decisively is critical when it comes to stopping the spread. And when the virus first appeared, Taiwan did just that. Vicadopia shows us why Taiwan's approach has been so effective and the lessons we can all learn from it.
Every week, tens of thousands of people travel between Taiwan and mainland China, yet there are fewer than 80 cases of COVID-19 in Taiwan. The health minister says the Taiwan CDC has been preparing for this for years. Both Canada and Taiwan saw their first people infected with the coronavirus within days of each other, but in March, Canada's cases surged, while Taiwan creeps up only incrementally, even when adjusted for its smaller population. This analysis of Taiwan's response to COVID-19 credits the island's health officials for taking action early, boarding flights and screening for sick passengers. Passengers now fill out health questionnaires on their phones while at the gate.
They could triage a large number of passengers very quickly without having them lining up in the airport.
Taiwan also tied together electronic patient files to immigration records, following up with those at risk based on their travel history, texting them to self-isolate if needed, and checking up in person, threatening fines if orders are ignored.
I think in the Canadian context that would be viewed as rather dystopian.
This doctor says Canadian privacy legislation would make Taiwan's level of data collection impossible, but she says Taiwan did the right thing with masks. Banning mask exports and price gouging. The military even took over mask production.
I was actually kind of admiring that because my struggle with not having masks in my office has been an ongoing one for the past month.
Taiwanese in self-isolation are delivered food and other supplies, as well as home visits to check on their welfare.
At least you're treated like a person and not a virus.
It's the combination of small gestures and big data that's given Taiwan an unprecedented edge over other countries in controlling COVID-19. Vicadopia, CBC News, Toronto.
You've likely heard by now those urgent calls to stop the spread and flatten the curve.
There's probably a pool of people who are truly infected out there that we don't know about.
Up next, are we doing enough? And we put your questions to the experts.
Plus, we keep hearing it's the single most important thing you can do. Wash your hands.
Between the fingers, wash the back.
But you may not be doing it right.
I'm throwing caution.
And later, musicians reaching fans around the world from the comfort of their own homes. We're back at 2. Welcome back. When medical officials talk about COVID-19 in Canada, you have probably heard them mention flattening the curve. And if you don't know, here's what that looks like. So this curve represents the number of cases in Canada over time. The dotted line is our healthcare system's capacity. Without precautions, we'd see a big spike, more than the system can handle. With precautions, the number of cases grows more slowly over a longer period of time. And our healthcare system should be able to cope. Magda Gebrselassie looks at whether we're doing enough.
If Canada is to succeed at delaying the outbreak and flattening the epidemic curve, we will all need to bring our best game. And
that game's playbook is all about keeping people apart, as well as locating and isolating the sick and protecting the vulnerable.
We probably could have done this earlier. We could have probably been more consistent.
David Buckridge says these measures are necessary and effective, but things will get worse before they get better.
In the next 2 weeks, even though we put in place these control measures, we're going to see an increase in the number of confirmed cases and probably an increase in the number of severe cases.
It doesn't mean it isn't working. It takes time to see the results. And there's another factor too, the return of Canadians from abroad.
We have people in Ontario and in Canada doing things that are going to help curb transmission, but then we still have this influx of travelers who are coming from places where there may be uncontrolled spread. You know, just because we're not seeing immediate effect doesn't mean that what we're doing isn't having an impact.
This epidemiologist says the federal government needs to do more. Close the border to U.S. citizens too, for one. He says officials also need to work harder to get the message out. TV ads and social media messaging with clear, memorable language.
When people are panicking, it's very hard for them to absorb detailed information about how they should behave and so on and so forth. You know, I'd love to see a campaign of bumper stickers and buttons and whatever to say, cough in your arm, do no harm.
A simple message that could have a big impact on that all-important curve. Magda Gebrselassie, CBC News, Toronto.
Well, Claire Patterson, who's a Canadian, was teaching at an English school in Spain when the virus tore through that country. She spent a harrowing few days trying to get out and fled just before the town she was living in was locked down. Well, now, after watching a slow response and people not taking it seriously there, she posted her message for people in this country. Here's parts of it.
All of my friends are there still. No one could fly back to their home countries because there's a fine for going outside. The hospital is devastated and is about to collapse. And people in Vancouver can't even resist going to a party. No one understands what's happening. We have the choice now to make a difference, to self-isolate if you've been in an airport, to social distance, to work from home. We have a choice to flatten the curve.
Okay, still ahead tonight. We put your COVID-19 questions to the health experts, what you need to know as the number of cases rises.
But first, why washing your hands is so important and some tips for doing it right. We'll be right back.
Well, there is no advice we've heard more of in the wake of this outbreak than wash your hands and don't touch your face. But easier said than done. For starters, most of us don't actually wash our hands properly. So early last week, notably before many of the current restrictions we have now were put into place, I got a lesson on why getting it right is so important. It's 9 a.m. at this Montessori in Ottawa, and these kids are about to get a lesson in something we've been hearing a lot about.
Can we see germs? Can we see germs? But let's imagine that we can.
Nisha Thampi is a mom, so she knows how kids can be. They touch everything and everyone.
And let's say I shake hands with you. You want to shake hands with me? How do we get germs off?
Why shake hands?
Yes.
But this mother is also a doctor. So what is it that you think in the test we're actually going to find? She's the head of infection control at CHIO, a pediatric hospital, and there's something she wants to show me. What are we about to try to demonstrate here?
You are going to show me how you wash your hands.
All right.
And
we start by spreading a fluorescent gel onto my hands that only shows up under black light.
Okay, so you can see the white.
Oh yeah, it's like a kind of white chalkiness, right?
Chalkiness, that's right.
The point is to show how we may not be getting our hands as clean as we think. And now I'll just wash my hands like I normally
like you would normally wash
So
your
I usually wet them a little bit. I'll get a little bit of soap on, and I just kind of do a quick little thing, never that long, and then I wash them off. Clean.
Okay.
You sound doubtful. you don't think that was enough?
Let's see.
Okay. Needless to say, my method, too short, not thorough, only somewhat effective. Oh, okay.
So you can see that there's still some white marking there.
Right. And that can be a real issue when trying to avoid getting sick.
But you got the palms.
I got the palms. Okay.
We know that with other coronaviruses that have been studied, that they can live on inanimate surfaces from hours to days. And so it would do us well to think about washing our hands when we come into contact with surfaces where there may be a risk of contamination.
And the opportunity for contamination is indeed everywhere. So here's what we're going to do. We're going to take some of this fluorescent powder this time around, simulate a sneeze into my hands, make some tea in the office kitchen, and then once again pull out our trusty black light. What you start to realize very quickly is how many things you touch with those dirty hands in doing the simplest of tasks. But let me show you. So first things first, we are going to check the kettle. And boy, you can see fingerprints right along the inside, all over the top, and right on the front there too. Come over to the sink. We can see right on the handle there, germs spreading. Went to the fridge. Oh yeah. And we can see all that along there. It's over the tea box. It's over the milk, even around the mouth where the milk comes out. And look at the cup. So if these were real germs, the chance of someone else coming into contact with them and getting them on their hands, pretty high. So what's the best way to get those germs off? Dr. Thampi shows me the World Health Organization's method, 6 distinct motions.
Scrub the palms between the fingers. Wash the back. Wash the back. Twirl the tips around. Scrub them upside down. Thumb attack.
Now, if all that, especially the last bit, sounds a tad childish, well, that's the point. The WHO method, but set to a familiar tune. That's Dr. Thampi's creation, and she goes class to class teaching it.
Between the fingers.
Now, keep in mind, these kids are all between 3 and 5. The task, daunting. How many germs do you think are in your hands?
Lots.
Lots? Like how many?
1,000.
1,000? Julie, I'm going to shine the black light at your hand, and I'm going to see how many of the germs you got off. You ready? Do you see how it's kind of sparkling? I thought you said you got all the germs off. Okay, show me the back. How many germs did you say were on your hands again?
13.
13 germs? You think you got all 13 off? You ready? Let's see. Okay, that's pretty good. According to a study published in the American Journal of Infection Control, kids who learned an organized, regimented way of hand washing had dramatically lower absentee rates from illness. And another study out of the UK found the method being taught here to be the international gold standard. In case you're wondering, these very same steps apply to hand sanitizer as well. And technique is important because it's only a matter of time before something that's gotten onto your hands gets onto your face. We do it to ourselves all the time. Over the course of about an hour working in my office, I touched my face 20 times, and that is very typical.
There's a very well-cited study talking about how individuals touch their face on average 23 times an hour.
23 times. Mm-hmm. And it's just, I mean, just like little
like you're
things
touching
like,
your
like
face
scratching
now.
your,
Yes.
right. And nearly half the time we touch our face, we're touching precisely the parts where viruses get in. Our eyes, nose, and mouth. Risky behavior without even realizing it. But hopefully, good habits can change that.
But these are very hard among adults, and that's why I enjoy having these conversations with kids, because they're still learning. Nose picking is not an issue in the adult world, but it's a real issue in the children's world.
Rub them upside down.
A lesson learned with a few simple lyrics for kids and adults alike.
Thumb attack.
I got to try harder, clearly. Another piece of advice we hear over and over is to practice social distancing. But how do you do that in a crowded grocery store? We asked Aaron Collins to look at how you can shop safely during a pandemic.
What you need to do to reduce your risk while you're grocery shopping is pretty simple. On your way into the store, remember to wash or sanitize your hands. You might want to think about sanitizing your cart too. When you're shopping, don't touch the produce unless you're buying it, and never touch your face. Remember, try to keep your distance from other shoppers and staff. A meter or 2 is best. As far as where you shop, it doesn't really matter, but if you can, you might consider using delivery or order online and then just pick them up. As for who should be shopping, let's state the obvious first. If you're not feeling well, you shouldn't be here. Same thing if you're elderly or you have a compromised immune system. And if you are healthy enough to shop, maybe think about picking up a few things for those that you know that can't. As for when you should shop, where possible, aim to avoid peak hours so you can avoid the crowds. Why people are buying so much toilet paper is due to something called panic buying, and it's why there's empty shelves in some places. Now, you definitely don't need to buy all the TP, but you might think about stocking up on any over-the-counter or prescription meds you might need. On top of food, it's a good idea to have enough cleansers and other supplies to last a couple weeks. Remember, keep your trips to the grocery store to an absolute minimum. And when you do get home, you might want to give your fruit and veg an extra good scrub. And on your way out, you got it, wash or sanitize your hands again. Aaron Collins, CBC News, Calgary.
And up next, we continue a new regular segment here on The National. You have been sending us your COVID-19 questions, and we are putting them to the experts. The answers after the break.
And later, children are home, and they too have some questions how you should be talking with them about the pandemic. Welcome back. Right now, trying to stay safe and keep others safe
can be a constant preoccupation, and everyone handles that stress differently. But just about every single one of us has questions, which every night we are trying to get answered by doctors, one at a time. So tonight, to help us out, Dr. Isaac Bogosh, an infectious disease specialist at University Health Network in Toronto, and Dr. Samir Gupta, a respirologist who also teaches at the University of Toronto, and both of you joining us from outside the studio. Thank you for making the time, for being with us. Dr. Gupta, I'll start with you. Question number one. Should I be disinfecting fruits and vegetables that I buy from the grocery store? And if so, how?
Well, so that's a tough one. I think the first thing to say is that, COVID-19 days are not the days that people should be going out and palpating 10 mangoes to find the most ripe one. So if you touch it, you buy it. But if you are buying produce, you don't know who else might have touched it. So the safest thing to do is to bring it home and to wash it down with soap and water, particularly if you're going to be consuming the skin and particularly if you're not cooking it.
Right. And talking about food, I mean, Dr. Bogosh makes me think of delivery, takeout, coffee. Is all that safe?
In general, I think it would be rather safe. But of course, we know that other people have been handling this. They might hold the bag and pass the bag to you. So I think just adherence to hand hygiene is appropriate. And after, you get your bag and you take your food out of the bag, it's just a good idea to wash your hands with soap and water or to use an alcohol hand sanitizer.
Okay, Dr. Gupta, next question for you. Are children really more resilient to this coronavirus, and why?
So just looking at the numbers, it looks like a lot fewer children were infected from the original studies that are coming out of China and other places now, around 1%. And so that does suggest that they either don't get it or they're better at fighting it off. Several theories around that. One of the theories is that there are 4 other coronaviruses which are sort of the cause of common colds. And one theory is that, kids are always getting sick, so they may have more recently had one of these coronaviruses, so that when they get exposed to the novel coronavirus, their immune system is kind of primed and ready for it.
Okay, Dr. Bogosh, next question for you, also from a parent, I suspect. Can my child have sleepovers or get together in small groups?
I think there's a bit of nuance here. And of course, we're told to really practice social distancing and really keep our space between other people and really not get into large congregations of individuals. Having said that, we're social creatures and we have to live our lives. And this is obviously going to have a large psychological impact on people, in addition to a clinical impact if people get this infection. So like really small gatherings, I think if everyone's healthy and well, between a small group of people, like a couple of kids having a sleepover, is probably acceptable. But if this is going to be one of those big birthday parties with 10 or 15 kids coming over, that's out of the question. But with just a couple of kids there, I think that's reasonable.
Okay, Dr. Gupta, next question for you. Could schools be shut down even longer than they already have?
I think definitely. I think people need to get ready for that possibility. Already some schools have extended the closure by a week. As long as we're talking about social distancing, we're not going to be in a position to say it's okay for kids to go back to school. That really is the opposite of social distancing. I think people need to think about strategies to start educating their kids at home as this period gets longer and longer.
Dr. Bogosh, is it safer to meet other people indoors or outdoors?
I don't know. That's a tricky one. We're going to be meeting people, and of course, keeping our distance from them. And when we think about out of doors, if we talk about droplet particles, that how this can be transmitted through droplet particles, usually those don't float around in the air. They sort of land within a foot or two from where they're released from somebody. So, maybe technically it might be slightly safer outside, but I think it might actually just not be that relevant.
Okay, and Dr. Gupta, we've got time for one more question. This one's for you. Can COVID-19 cause long-term damage to your health?
So I would say not for most people, but for people who get really sick, certainly that's a concern. We know that it can cause pneumonia. It also causes something called acute respiratory distress syndrome, or ARDS. We know that pneumonia and ARDS in itself can leave scars in the lungs, and people can have long-term problems with breathing. We also know that when people get really sick and end up in the ICU, there are long-term consequences from that. It's a very traumatic thing for the body, and people have some loss of function after a long time in the ICU. So if people get, the people who get really sick from this, they will have long-term consequences from it. But the good news is that most people won't get really sick from it.
Okay, smart questions, smart answers. Dr. Gupta, Dr. Bogosh, thanks so much for your time.
Anytime.
Thank you.
Now, as we mentioned, we will be asking your questions about COVID-19 every night going forward, so please send us the questions that you do have. You can message us directly on Instagram at CBC The National or email thenational@cbc.ca.
Indeed, excellent questions. When we come back, talking to kids about COVID-19.
I'm scared that I might get it and it won't go away.
How to keep them calm and informed. That's next. Welcome back. We all know the uncertainty of this novel coronavirus has caused a lot of worry for many Canadians. From school closures, constant news updates, and travel restrictions, it's all a bit overwhelming. And for many parents, it means calming the worries of their kids. Here's what Tashana Reed found when she checked in with the family last week.
Brothers Noah and Levi Rackmel are keeping busy. The next 3 weeks will be a lot like this.
How come you guys won't be able to go to school?
Because coronavirus is taking over the world. I'm scared that I might get it and it won't go away.
Like many kids, coronavirus is on their minds.
Have mom and dad been helping you when you do feel worried?
Yeah, they'll either give me a hug or say don't worry.
It's a scary reality, and not just for them, for mom and dad too.
It's been really unprecedented in our lives, obviously, to deal with something like this. I don't think you can help but be anxious as things are progressing the way that they are.
Parents Michael Rackmel and Laura Chadola pulled the plug on their March break trip to Ottawa. With uncertainty in the air, they've been trying to keep calm and reassure their boys.
We're wanting to let our kids know that it is serious, but maybe not giving them all of the detail.
So, how much should you tell your kids? Child and teen psychiatrist Rachel Mitchell says if your kids are young, just stick to the facts.
Avoid abstract concepts. Keep it short, keep it brief. Ask them what they know already. Answer only what they ask.
If you have a teenager, talk to them like they're an adult. And her advice for parents, be aware of the impact of your own anxiety.
Your anxiety rubs off on your child. If you are calm, they are more likely to be calm.
What are some of the things that...
For Noah and Levi, despite some worries, they're happy to share what they've learned.
Wash your hands. Wash your hands a lot and not put their pinkies or any kind of finger in their mouth.
For now, the Rackmels say they're keeping things honest and positive at home and will take things one day at a time. Tashana Reed, CBC News, Toronto.
Okay, the moment is up next. First, though, as we go to break, a little neighborhood entertainment, an impromptu porch performance in Toronto.
With a ribbon on it, around her shoulders was a Galway shawl, as we kept on walking.
I don't really know how to work this, like it's a miracle.
Well, there she is. And of course she knows what she's doing. That is Canadian singer Jan Arden. And yesterday, she decided to do her part, bring a little light to her fans, performing a mini concert on Facebook Live from her living room. And she's certainly not alone. Music venues are shut down. But as they say, the show must go on safely, just with a little social distancing. And that is our moment.
I'm throwing caution. What's it gonna be? Tonight the winds of change are flowing wild and free. And make our road.
Will you remember me when I'm gone? Will you remember me at all?
So, can I be honest? So when I first heard about these sort of free concerts being posted online, my first thought was, don't we have every iota of entertainment already available on YouTube? But no, but this is actually quite nice in the end. It's a very human thing.
And it's about the shared experience. When
Yes,
we're all
yes.
separated, to be able to come together in some way in front of a TV or phone, it's kind of nice. That is the National for March 17. So before we go, remember, you can always turn to CBC News Network for the latest on COVID-19. It's now free for all cable subscribers and available for everyone to stream online and on GEM, no matter where in the world you are. Thanks for watching. We'll see you here again tomorrow night.
Good night.